Welcome, everybody. Today we are going to try to tackle the issue of how is it that clinicians can evaluate mobile apps for mental health before they recommend apps to clients. And then how can people that are looking to utilize the apps for themselves for mental health, how is it that they can evaluate, what apps ought they use for particular things that they're wanting to work on? So today I have Dr. Stephen Schueller with me. He's the assistant professor of psychological science and informatics at the University of California, Irvine, and the adjunct assistant professor of preventive medicine at Northwestern University, Feinberg School of Medicine. His work focuses on making mental health services more accessible and available through technology. This includes the development, deployment, evaluation, and implementation of technologies, including internet websites and mobile health apps. He's focused mostly on common mental health issues like depression and anxiety, but with a strong interest in reaching underserved and marginalized populations, especially homeless youth and Latinx populations. He's the executive director of cyberguide.org, which we will take a look at a lot today as a great resource for evaluating apps, which is a project of One Mind, a nonprofit organization that aims at empowering people to make informed and responsible decisions regarding digital mental health products. At UC Irvine, he's the director of the Technology and Mental Health Lab, and he co-leads the implementation evaluation core for the Formative Evaluation of California's Mental Health Service Authority Innovation Tech Suite, a multi-county collaborative focused on using digital apps to improve the impact and efficiency of county mental health services. So, Dr. Stephen, I'm really glad to have you here with us today. The way that I found Cyber Guide is because I am currently on the American Telemedicine Association's task force for looking at developing a kind of a grading tool for mobile apps for depression. And we came across Cyber Guide, which I think is a fantastic resource for people to evaluate mobile apps. So I'm really glad that you've put your work and time into this, and definitely want to explore it and provide our audience some really good information on this. So Dr. Stephen, if you could tell me maybe just to start, what got you started in this? Why create Cyber Guide to begin with, and how'd you do that?
Yeah, I think that the need, so Cyber Guide's been around for 6 years, and what I often say is that 6 years ago, there were not a lot of apps with not a lot of evidence. And so there was a big need to try to point people to what are the quality mental health apps that are out there, and what is the evidence behind those mental health apps that exist. 6 years later, we're not in a terribly better position in that there are a lot of mental health apps out there and not a lot of evidence. And so the problem in some ways has gotten even more challenging to find these sort of quality products. So we were lucky to have support of One Mind, which is a philanthropic organization that funds mental health research behind the idea of Cyber Guide. And so with their support, Cyber Guide was launched 6 years ago to really sort of function a little bit like a Consumer Reports for these digital mental health products. And we don't only review apps, we also look at some other products like wearables, internet websites, but it just so happens that a lot of the space right now is in sort of the mobile app space. And so that was really what sort of necessitated the need, which is just the vast number of mental health apps that are out there. There's estimates that there's somewhere between 10 to 20,000 of these things that exist. And the lack of quality information around which ones have evidence behind them, which ones have good user experiences, which ones have reasonable protections or information around their data security and privacy policies. Of those 10 to 20,000 apps that exist, the estimate is about less than 5% of them actually have any evidence-based behind those applications. And so there's a big sort of chasm between what's out there and what one might recommend folks to use.
Sure, yeah. So maybe to begin, what I'll do is I'm going to show the website. Yeah, so I'll show the website that we had, the Cyber Guide site, so people have an understanding of how to use it. And so here's Cyber Guide, and in terms of how it works, kind of what you were talking about there, Dr. Stephen, is you look at credibility, user experience, and transparency.
Yeah, that's correct. So yeah, we evaluate apps on these three characteristics. So credibility is the degree to which evidence supports that the app can do what it says it could do. Does it have direct scientific research behind it? Does it have a quality development team? So is there clinical expertise? Is there technical expertise? Is the app continuously or recently updated? That's actually something we see through research that, not surprisingly, apps that developers are updating more frequently tend to be higher quality and people have higher benefits. There's a study that showed that one of the best predictors of app quality was it updated in the last 6 months? So all of those things kind of factor into what we refer to as our credibility score.
Yeah. Question about the credibility in terms of evidence, right? Because the evidence-based is part of the credibility. Is that right?
Yes. Yep.
Yeah. So we have evidence-based, say, evaluation tools, right? So being able to evaluate whether or not someone's depressed and how depressed they are, and with anxiety and so forth. So we have some good evaluation tools for those kind of things, but they haven't really been tested for their usability on apps themselves. Mm-hmm. So we have the credibility of the evaluation tools, say if they're conducted on site or on paper, but not necessarily through an app. So do you, in terms of that credibility, how is it that you look at that?
Yeah, I think that's a really great question. I think it's actually one that the field is still struggling with. I think that when you have digital tools for assessment, you can evaluate the validity and the usefulness of those tools in digital mediums. And so in some places we've actually seen this work be done. So for example, John Toros has done some nice work where they looked at the validity of the Patient Health Questionnaire 9, which is a common evaluation tool for depressive symptoms, both in a paper and pencil and a mobile version, and they found sort of high rates of concordance, although maybe some differences in terms of reporting of individual values of things. So I think that it is useful to do an assessment of the assessment in digital formats to understand, if those things work. And that's definitely something that we do look at CyberGuide is, is there sort of evidence behind this tool, if it's serving the role of assessment, that shows that it's got, good validity and good sort of usefulness. Now, I will say this is something that we actually run into fairly regularly, in which we might have a developer reach out to us and say, well, we've used this established measure, assessment of this thing is useful, and so that's why this app we have is evidence-based. It's like, well, can you show us, or do you have some research that suggests that this tool actually has validity in a digital format, or that you've evaluated the usefulness or the validity of the specific digital tool that you have? And they, oftentimes will shrug their shoulders and say, well, no, we haven't done that yet. It's like, well, that's the reason we give you the credibility score that we have on CyberGuide, because we would really love to see the evidence that this tool actually translates well to a digital medium. So I think it's definitely something that can be evaluated, but something that is often not evaluated when we look at the evidence behind some of these digital tools.
Mm-hmm. Yeah. Okay. Excellent. Um, and then we have, let me just share the screen here again. You have the user experience,
Mm-hmm.
which is certainly an important piece. People aren't going to use it if it's not a friendly app to use, and you want it to be you don't want it to be confusing. Can you say a little bit about that in terms of how it is that you evaluate the user experience? Like, do you who is it that you have tested out to give you the feedback? Looks like you use the Mars evaluation tool. Do you have, say, a certain amount of users rate the app using the Mars tool, or how does that work?
Yeah, so the mobile app rating scale, or the Mars tool, is a very widely used assessment for the user experience of mobile apps, especially in the health space. And it sort of breaks down the assessment of that into various different categories. How engaging is it? How functional is it? What is the sort of visual appeal? The graphics, the colors, the layouts, what's the information available in the app? How accurate and easy to sort of access is that information, that material?
Mm-hmm.
So the Mars scale is a developed tool for assessment. It's been validated, but it does require some training. So I think that's an important sort of piece of what we do, is that the individuals we have make these Mars ratings are people who've been trained to use this tool. They've gone through a process where they learn how to use, what we're looking for on these different items, what differentiates a 2 from a 3 from a 4, how to actually think about sort of using this tool. And then when we do a Mars assessment, our scores on the CyberGuide website actually represent an average of at least 3 raters that are selected across different, for different expertises. So we usually have someone with clinical expertise in the area that the app is developed for. So if it's a youth-focused app, for example, someone with youth expertise. If it's a depression app, someone with depression expertise. So there's a clinical expert. There's usually a technical expert, so someone who has experience developing or understanding sort of technologies and engagement sort of aspects of those. So it might be a technologist or someone with expertise in human-computer interaction, or someone with expertise in digital health. And then we have a consumer rater, so someone with lived experience, again, trying to match to the different sort of population characteristics that are important for those applications. And so we'll average the scores across the different raters to create the score that's posted on our website. But again, I think one of the really critical things is that these are people who've been trained and have undergone training and supervision to use that Mars scale, because that's the way that we can ensure that the ratings that we have coming from that are high quality and consistent.
Yeah, that makes sense. Like you mentioned Consumer Reports, and I always wondered how Consumer Reports does that, because they get ratings from consumers, and how do you want to be able to match apples to apples? Like,
well, I think it's the same thing that a lot of us are probably familiar with as clinicians and practitioners, in that when we get trained to do assessment or diagnosis, we go through training in terms of how to use those the sort of standards of our field, and we get supervision around making sure we're assessing the right things. And so we treat this Mars scale and this user experience training, and actually all aspects of their training, we do a similar sort of process where we train and we look for reliability of the rater before we allow them to rate the products and post their scores. But we want to make sure people are using the scale appropriately.
Yeah. Okay. Excellent. And transparency, I'm really glad that you cover this. I like the icon of the key because it has to do with privacy, right? So are they being transparent with what data is being, say, captured, retained, possibly shared with outside sources and so forth? I assume that's what what this is about. Is that right? The transparency?
Yeah, that's exactly right. And we call it transparency as opposed to data security and privacy itself, because what we're doing is we're looking at the information that's present and evaluating that information. We're not doing a full sort of technical audit of the app. So, we're not hacking the app and looking at, if they say the data is encrypted, are they actually encrypting the data? If they say they're storing this information, is that the information that they're storing? Unfortunately, that's beyond the resources that we have at our website to do those reviews. That being said, what we do is we do a thorough review of the privacy policy that is in the app, on the app's website, in the app store related with the app, and we look at the information that's there to make sure that it is saying that certain practices are being followed. And I think that it's really important to note that even that bar we have of reviewing these privacy policies shows a lot of differentiation between different apps. So we divide things up and based on a sort of standardized scale that we've developed and validated into 3 categories: apps that are unacceptable or have unacceptable privacy policies, apps that have questionable, which is usually where it seems like it's okay, but there's some important pieces of information that are missing that make it unable for us to determine if they're meeting sort of a higher bar around data security and privacy, or apps that have acceptable sort of privacy policies there. And what so we developed this measure, and we looked at it with over 100 different depression apps. And what we found is that for those apps, about half of them didn't have privacy policies. So that by itself is, very concerning that, the state of the field is that a lot of stuff just isn't telling you what they're doing with their data, with your data, or what their policies are to protect it. And of the apps that did have privacy policies, most of those apps were unacceptable based on our rating. So those privacy policies were lacking sort of key pieces of information, or were telling you things that would not meet standards for data security and privacy, so that they are definitely selling your data to third parties, or that they're using it for different sort of purposes, or that they are not sort of protecting it or storing it in a reasonable sort of way. So there is a lot of buyer beware there.
Yeah, so it's not just that in order to get the acceptable rating, it's not just that they are transparent about the privacy and security. It's that it is they're reasonably keeping the information private and secure.
Yeah, that's exactly right. So they both have to provide the information, and that information has to conform to standards for collection, storage, and exchange of health information.
Okay. All right. Perfect. Yeah, that's great. That's what we'd want to see, definitely. Now let's take a look to actually take a look at some of the apps. Where would we go?
So we can click on the app guide. You can either do that from the top toolbar there where it says app guide, or you could click later on the page. So this is our app guide. There's 2 different ways to view it. The default is this card view that you have right here. If you click on that top bar where it says table, you can also get a tabular version that will list all the apps without as many sort of icons or color. I personally prefer the table version when I view it myself, but I'm more of a academic who likes tables and, just wants the information presented to me. And you can see that on this table, we have the apps displayed. The default way that apps are displayed is that they're sorted by credibility. You can change that if you go to the left hand of your screen there. You can see that it says sorted by credibility. So you can change that to sort by user experience or transparency, depending on what aspect you care most about. So if you really want an app with a lot of scientific evidence or support behind it, credibility would be the way to sort of score or rate those. If you want an app that has like a very slick user experience, so it's easy to use, free from bugs, you might choose to rank it by user experience. If you're really, if data security and privacy is really critical to what you're doing, for example, if you're working in a health system, or if you're a provider, you might only want to use apps that are reaching that highest level. You could sort by that aspect. And then in addition, we have these expert reviews for some of the apps, and expert reviews are longer narrative reviews that really walk through the pros and cons of a different app, that tells you how to use it. So if you have an app that you really like and you just want more information around how you might be able to use this tool in your practice or in your life, you can click an expert review that will give you more information about that. And these expert reviews are all conducted by external experts to our team, who use the app for an extended period of time and write up this information related to it. So you can see that these expert reviews are chock full of information. It's like drinking from a fire hose, to get this information, but it's really, really useful once you find an app or a couple apps that you're interested in, to get some more detailed information about what this product is and what it does.
Yeah, so a clinician would certainly want to drill down by looking at that expert review. If they're not going to, of course, I think clinicians ought to evaluate apps themselves also, because they're constantly, they're kind of a moving target. They change, they evolve, and so forth. They might become out of date. So they definitely ought to take a look at them themselves, but reading this expert review will give them a huge head start in terms of understanding at a detailed level of, what's the appropriate use case, how does it work, all that kind of stuff, benefits and drawbacks, things to look out for, right?
Yep. I think that's exactly right. And I think that's an approach, that's a perspective we really share at CyberGuide. And that there's a couple different steps that have to go into one's decision to use a mental health app, either in your practice or in your life. The first sort of big challenge is just finding one, and finding a good one. As I mentioned, there's like 20,000 apps out there in the mental health space. And so I think CyberGuide can really help find a couple options that might be sort of reasonable options to consider. And I think each person or clinician should review those products for themselves, and try to understand sort of issues. If you're a clinician, does this work with the client population that I have? Is this consistent with the treatment strategies that I provide? Does it have features that link into the different ways that I'm providing treatment? For a consumer, you might ask sort of more specific questions like, is the layout something that appeals to me? Does it have features that sort of fit into the context of my life? But I think that those are important questions, and that's sort of the app evaluation component. And so we do some of that at CyberGuide for sure, but in broad strokes. We try to figure out, what are the general apps that are meeting certain benchmarks and have high standards of credibility, user experience, and data security and privacy. And I think ultimately, we really do encourage clinicians or consumers to do some review themselves to understand, is this actually a good fit for the reasons I want to use it?
Yeah, and with thousands of apps out there, how is it that you decide which ones to review?
Yeah, that's a great question.
To do it.
Yeah, well, we have a big, fantastic team that works at that. So, that's one of the jobs we feel like we have at CyberGuide, is this job of app identification. So consistently looking at the market in terms of what's out there and updating our information. So we have a variety of different ways in which we find apps. We consistently search the app stores ourselves. We've also set up a lot of automated processes for doing so, Google alerts and things of the sort, to see when new apps are posted, but also when information about apps is coming out. We look at the research literature consistently, and that's one of the goals we have at CyberGuide, is to promote higher quality products. And so if there's something that's been researched, a new paper comes out, we want to make sure that if that product is available to consumers, we highlight that and have that included on CyberGuide. We also have a variety of different partnerships with organizations like Anxiety and Depression Association of America, or ADAA, the International Obsessive Compulsive Disorder Foundation, or IOCDF. And through some of those partnerships, we get references for certain apps that they would like us to review on their behalf, that they would then share that information with their constituents. And so some of that information about which apps we should prioritize is coming through our partners. And then we also get some requests from developers themselves. They say like, we've made this new product. It's relevant to some of the stuff you're doing at CyberGuide. We think it would be useful for you guys to include on your website. And then we do a sort of full review. So that's how we identify some of the different products. The next step we have to go through is a step of prioritization. So how do we decide which products to actually review? And a little of it's an art and a little of it is a science. So the science side is that we try to prioritize things that people use and things that have evidence. So we look at the number of reviews and ratings on the public app stores. We look at analytics based on number of downloads. We look at the amount of research studies that are behind those things, and we prioritize apps sort of based on all of those sorts of things. And so, I do think it's possible that there might be some diamond in the rough apps, which are apps that could be potentially really useful for people, but people haven't really downloaded and haven't really used. But when we look across the field, what we see is that the majority of app downloads and app use comes from a very sort of small set of products. So there's a paper that was done a couple of years ago. It's probably a little bit outdated in terms of its the actual data, but I think it's painted an interesting story where they looked across all health apps, not just mental health apps, and they found of the 325,000 that were out there, the top 10 apps accounted for 50% of the downloads. So a lot of the use is going on at the top. And so I think that's one thing that we're trying to do at CyberGuide is we focus on the top. The other sort of thing that gets into a little bit more of the art is we also try to be responsive to both our constituents as well as the constituents of the partners that we have. So we pay attention to the traffic on our site. What are people coming to and what are people looking for? And try to build out content that's based off of what people are coming to the site to find. We also, do the same thing for some of our partners. So for example, when we started our partnership with IOCDF, we didn't have a lot of OCD apps on the site. And so we wanted to make sure we built up a library of those products. And I think also just out of a need for people's need for the CyberGuide website, we want to have products across a variety of different populations and needs. And then we also have some targeting for different events or different sort of time events based on interests. So for example, for Pride Month, we made sure we highlighted some products that are focused on LGBTQ mental health. For Suicide Awareness Month, we made sure we had some products that were specifically focused on self-harm and suicide. So and that information usually gets shared then through our social media and our members who stay connected with CyberGuide either through social media or our newsletter. So some of it's a little bit of a picking to make sure that we have products that sort of meet the times and the needs of what people are looking for.
Yeah. So, I see that you have a lot of these big categories here listed, like assessment and screening, chatbots, cognitive behavioral principles, cognitive training. But you mentioned some others, some other categories. Is there a way on the site that someone would be able to find?
Yeah, I think a lot of this actually right now lives under our resources page. So if you go back to the top bar and under more, so it's the furthest right, okay. Resources.
Yep.
So we have some resources around, what is mental health. But if you click on this digital mental health tools down below, apps at a glance, mobile app toolkits. Oh, sorry, just go back to the left. It's the first one. So if you click read more there. Here we have a lot of the different app toolkits we've created around different areas. So you can see apps for veterans, for managing depression, for stress management, for OCD, for trauma survivors. So these are examples of some of the content that gets shared out on our social media around different events. And we keep it here at CyberGuide for people to view. So it's a sort of an abbreviated snapshot version of some of the apps that are focused on specific populations or for specific needs.
I see. Okay. Yeah.
But I'd also really encourage if folks are interested in keeping track and following this information, to follow us on our social media channels, Facebook and Twitter, because we consistently sort of share out this information based off of, like I said, some of the different events and awareness months and weeks that are going on in mental health.
Excellent. Perfect. And, you know, a lot of the app stores vet out apps a bit on their own. What do you think about that process? How good of a job do you think they do in regards to that?
Yeah, well, I think that the app stores vet apps out based on the things that they know. So they know how to figure out sort of some of the, is it meeting the basic technical requirements of the App Store? Is it following their terms of services in terms of payment models, if they exist in the app? Is it free from any sort of, you know, egregious sort of stuff around, you know, some of the advertising, some of the practices there, but they don't have the content expertise to really sort of understand the mental health benefits or potential, you know, iatrogenic effects or challenges with these different products. So I think that when you download an app, you can assume that it's meeting the terms of services that the App Store has, but it doesn't mean that it's necessarily effective or impactful in terms of what they say that they can do.
Yeah. And then the interoperability, being able to share the data on the app with, say, a clinician. So if a client's using the app, being able to share that data with the clinician that they're seeing or with others, or getting support from the community that uses the app. Is there information about that on your ratings, or would that be under?
Yeah, I think it would mostly show up under our expert reviews if it exists. I think that, you know, I do think that our ratings are sort of focused more on the experience of using the app and a little bit more driven towards the consumer side of that experience. Is it credible? Is it likely to be effective for them? What's the user experience? What's the data security and privacy? So we don't have a lot of information in the ratings around interoperability. I'll say, you know, it is something that we look at, and what we tend to find is that very few of the apps actually have those features for interoperability. So I think it's something that clinicians need to consider, is if they really like an app that doesn't have a lot of features or ability to bring that data into the provider, what's the process that they go through to actually get that information to them?
Okay, yeah. And how can people support CyberGuide? Because I mean, it's a very, very important effort that you guys are making and doing, and the services that you're providing. And I know it takes a lot, right? It takes a lot of time to review an app and so forth. So how can people support the cause?
Yeah, I think there's a couple different ways that people could support CyberGuide. I think one is, you know, we are a nonprofit affiliated with One Mind, and so we do have a donate button on our page, and so you can donate to One Mind and indicate that that donation wants to go to support the CyberGuide cause. So yeah, right there at the top of the page, you know, we rely on the generosity of the donors and the generosity of One Mind and the vision of One Mind to really support this product. I think it also is just really beneficial for us to have a community of people who are interested in this. And so, like I said, following us on our social, our Facebook and our Twitter. We also have a newsletter that we send out that you can stay connected with, that we send out on a monthly basis, that talks about what are some of the updates that are going on in CyberGuide. I think it's under the About. I think if you go to About CyberGuide is where you might be able to sign up for that newsletter. This is the challenge, of course, is that I've been on the newsletter so long, I forget where it was I actually signed up for it. So I think probably at the bottom of the page here, okay, I'll have to look for where that is next time. I have to be more prepared. We have a newsletter. It's definitely on here where you can join our newsletter. I think also just, you know, staying connected. If you're a practitioner and you're interested in being more involved, you know, we do use various practitioners who write expert reviews for us. We also have blogs that get written by a variety of different people, and we have guest blogs on a monthly basis. And so if you're working in this area and want to show us a little bit of indication that you're doing that, we're always happy to have and get we have wonderful contributors for our guest blog, and so we're always happy to also grow that community. And we also have for developers, we have a LinkedIn page that's for developers in the mental health, digital mental health space to try to connect that community. So I think there's various different ways to get involved here.
Yeah, excellent. Yeah, well, thank you very much, Dr. Stephen Schueller. Really appreciate all the information that you shared with us. I know this is very helpful for people to help them navigate the mobile apps, which people use a lot. It's help at people's fingertips in between sessions. Even if there's not interoperability, clients could bring their mobile phones into a session and show, say, like their dashboard and so forth to their clinician, which is very helpful. So yeah, greatly appreciate your help and all of the time that you spent with us.
Yeah, thanks so much. I really appreciate your interest and the interest that you have in CyberGuide. So happy to share about what we're doing.
Excellent.